Gum disease is caused by bacteria. All dental decay and gum disease are both caused by bacteria. And the idea of brushing, flossing and using these little brushes is to remove that bacteria, remove the plaque. And when you remove the plaque, both hard and soft tissues can become and remain nice and healthy. The early sign of a gum problem, of periodontal disease, gum disease, is if your gums are bleeding at all when you are brushing or flossing. If your gums are bleeding, it means you have the early signs of some gum disease. The earliest stage has got a technical name called gingivitis. It just means inflammation of the gums around near the margins of the teeth. Now, if left untreated, that can develop into a more serious problem whereby you can start to lose the supporting bone around the tooth. The gums become puffy, it can develop bad breath problems, and eventually, if left untreated, you may have to lose teeth. They may have to be extracted or they may get wobbly and eventually fall out. However, if you have developed gum disease, all is not lost. It can be treated as long as we get onto it and treat it carefully and effectively. In the early stages, a very careful and thorough cleaning of your teeth is what we need to do here in the surgery. And we may need to do that over a couple of sessions. We may need to do it with the help of some local anaesthetic, because if you have got some gum disease that is already quite well progressed, we need to get down and really do a deep cleaning of those teeth and gums. And in order for that to be comfortable, we use some local anaesthetic. We do also have a product for cleaning the teeth, and where it is a local anaesthetic, but it's just placed on the surface of the tooth, and so it's like a topical gel that can sufficiently numb the gums without actually having to give you an injection. And that's very effective for many people who need that thorough cleaning a little bit more than just our regular prophylaxis. In addition, we can also use other things that we have in the practice, such as our laser unit here. Our KTP laser can also be used to help treat your gum problems. The way that it will do that is that after we have done your thorough cleaning of your teeth and around the edges of the gums, we shine the laser in around under the edges of the gums, and what the laser does, it actually kills those bacteria. So it mops up or kills any residual bacteria that might be there. And so it renders all of those areas much more sterile and allows the natural healing processes to occur. If your gum disease has developed to the point of periodontal or periodontitis problems, well, it can still be treated. We may, in some situations, we may certainly need to refer you to a specialist gum dentist known as a periodontist, and they can perform some specialised treatments and save your teeth that might otherwise be lost. And we will certainly do that if we believe that to be necessary. If your gum disease has reached the point where we simply cannot, either ourselves or our specialist periodontist cannot save your tooth or teeth, then we have to look at our other options, such as dental implants to replace those missing teeth or other appropriate options. Talking about all those possible problems is all a little bit negative, I suppose, and hopefully our take-home message is a positive one, and that is prevention is better than cure. Good brushing, good flossing, using your little Pixters and all that sort of thing, good diet, and all those sorts of things that we will talk about during your preventative treatments and visits. All of those things will help to ensure that we never have to enlist the help of all of these advanced treatments that we can do for you. So it's much better to maintain a nice, healthy, clean mouth and to avoid all of those problems in the first place.